Good evening. Thank you for your introduction and thank you for giving me the opportunity to present my work. My name is Benjamin Deniau. I am physician in anesthesiology and critical care in Saint-Louis Hospital, and I work in SAM Unity 942, directed by Alexandre Mebaza. Today we will talk about the cardiovascular biomarkers in postpartum hemorrhage. Postpartum hemorrhage is a worldwide health problem. It's defined as a cumulative blood loss above 1,000 milliliters between the delivery and 24 hours after delivery. Postpartum hemorrhage is the first cause of death of a woman in the world, with a rate death between 8 in developed country to 20% in underdeveloped countries. The etiologies of postpartum hemorrhage are summarized in the 40 group. The first T for stone anomaly, uterine atony, traumatism like laceration or rupture uterine, tissue anomaly like retained placenta or clots, and the last one is thrombin anomaly with clotting factor deficiency. The management of postpartum hemorrhage is based on resuscitation measures like fundal massage, the use of uterotonic drugs like oxytocin and sulprostone, resuscitation measures like transfusion, catecholamine, mechanical ventilation if needed, and surgery, artery embolization. But postpartum hemorrhage is followed by a high rate of morbidity, and PPH represents a traumatic childbirth experience, namely with the occurrence of post-traumatic stress disorder, anxiety, and depression. Up to 20% of women who experienced PPH develop traumatic childbirth and mental illness. PPH is leading to avoidance of maternity care and long-term consequences. Unfortunately, risk factor of postpartum hemorrhage to develop mental illness are poorly studied, and the association between cardiovascular biomarkers and postpartum mental illness have never been studied. So, the aim of this study was to assess the association between cardiovascular biomarkers in postpartum hemorrhage and the occurrence of mental illness at 6 months after delivery. This is the HealthMob study. HealthMob study is a prospective multi-center and national study done between November 14 and November 15, and each patient were managed according to the international guideline for PPH management. Here, this is the flow chart of the study. Women were included when the diagnosis of PPH was made, defined as a bleeding above 1,000 milliliters of blood and the use of sulprostone, and 2 time points of biomarkers, of measurement of biomarkers have been done at inclusion and hospital discharge. 4 biomarkers have been measured. The first one is DPP3. DPP3 is a biomarker of shock. Troponin T, NT-proBNP, and GDF15. GDF15 is a cardiovascular biomarker increased in acute heart failure. After hospital discharge, patients have been followed up during 6 months, and a psychological evaluation was made to detect the occurrence of anxiety by using HADS score, post-traumatic stress disorder by using EOS score, and the occurrence of depression by using the EPDS score. The results. 332 patients were included in the HealthMob study, and 2,038 patients were followed up until 6 months. The median age of the patient was 34, parity was 2, and pre-existent mental disorder in 9 patients. The main mode of delivery was vaginal and followed by cesarean delivery. In the HELP-MOM study, the main cause of PPH was uterine atony, followed by abnormal placenta insertion, uterine rupture, and vaginal laceration. Interestingly, 163 patients developed psychological disorder at 6 months, namely anxiety, depression, and post-stress traumatic disorders. This slide summarizes the level of biomarkers at inclusion, that is to say, at the moment of the PPH. The level of DPP3 was 39 nanograms per milliliter, TNT 14, NT-proBNP 88, and GDA 15, 18,000 picograms by milliliter. Interestingly, we found that NT-proBNP was higher in patients who developed psychological disorder at 6 months, and in multivariate analysis, you can see that high NT-proBNP at the moment of the bleeding was associated to a higher risk to develop psychological impact at 6 months. Concerning biomarkers at hospital discharge, the same biomarkers, DPP3, TNT, NT-proBNP, and GDF15, and the same way, we found that NT-proBNP was higher at hospital discharge in patients who develop psychological disorders at 6 months. And when NT-proBNP was high, the risk to develop psychological disorder is high. So, to conclude, we found that high NT-proBNP levels during postpartum hemorrhage and discharge were associated with a higher risk to develop psychological impact at 6 months. This is the first time these results were observed. Levels of NT-proBNP negatively influence score of quality of life in heart failure and coronary artery disease patients, but it have never been found in hemorrhagic shock during postpartum hemorrhage. Interestingly, biomarkers of shock, namely DPP3 and troponin and GD15, were not associated with higher risk to develop psychological disorder at 6 months after hospital discharge. And further studies are needed to confirm this result. Thank you for your attention.
Yes, Dr. Collins.
Great job. It's a very interesting presentation. I always think of troponin and natriuretic peptides as markers of problems. When they're elevated, whether it's sepsis or ACS or heart failure. I had never thought about it in postpartum hemorrhage, but those numbers are fairly dramatically different in negatives versus positives. What do you think the causal link is between elevated natriuretic peptides and postpartum depression? Do you think they have subclinical heart failure, which is associated with poor quality of life and depression? Like, I can't make the mechanistic link.
This is a really good question. Thank you so much. I don't have the answer of this question, but it's probably due. The rate of heart failure in this cohort is the same between patients who develop psychological impact or not. But we have to analyze if the volume of the bleeding is associated with a risk to develop psychological disorder. These results are the second analysis of HELP-MOM. We will publish very quickly the first analysis of HELP-MOM study, and we found that the lowest hemoglobin value is associated with a risk to develop psychological disorder at 6 months. Okay, but I don't know why there is no signal of cardiovascular biomarkers. I don't know why.
Interesting. Or even looking at another functional outcome to see if that was a difference, like a walk test, or in heart failure it's the KCCQ, but something else to link that imaging functional outcomes would be interesting to see.
I think one of the answer could be the volume of fluid therapy, for example. Maybe the fluid therapy is important, maybe the patient is very, very severe, and the impact at 6 months is higher.
Dr. Massif.
You analyze the 6 months mental alterations, but I think one of the most risky complications of postpartum hemorrhage is hypophysis damage, and some patients that may develop hormonal problems. Did you analyze this?
This is preliminary. Thank you for this question. This is a preliminary analysis of HELP-MOM study, and the duration of follow-up in HELP-MOM study is 5 years. So I think I will answer to this question next year.
We have another question.
Thank you for addressing this condition, which only affects maternal health. It's very important. Do you know how the blood pressure was in these women? Because we know that women that have postpartum hypertension have elevated NT-proBNP. But on the other hand, with blood loss, you would assume that they had low blood pressure, probably directly after birth. Were they maybe overly compensated in terms of volume, maybe?
Thank you for your question. Systolic blood pressure and mean blood pressure is the same between the two groups. Diastolic blood pressure was lower in patients who develop psychological disorder at 6 months. Okay, and interestingly, we found that the use of norepinephrine is identical in each group.
Okay. And also, I think that just in general, women who have had a traumatic event related to their birth, we see this also with postpartum hypertension, preeclampsia, HELP, they have a tendency to develop depression after. I mean, that link is well known as well. But thank you very much.
Thank you.
I got a question. So I love these things that don't make any sense, and this makes no sense to me, why the NT-pro would go up. There are markers of psychiatric dysfunction, and so the first question I have for you is, do you have any blood frozen for future analysis?
Absolutely.
Good. Because S100 beta has been shown to be a correlate with suicidality, and patients with low S100 beta don't have it. Post-traumatic brain injury, there's a lot of biomarkers. There's like 200 of them, and that would make sense. And they are correlated strongly with post-traumatic stress disorder, which could be absolutely what this woman almost died, and you'd expect her to have some PTSD after that. And those markers it may turn out that the BNP is just sort of red herring that's dragged along with these other more predictive markers. But congratulations on it. Great.
Thank you so much.
Study.